Some caregivers have learned to lean on humor in these moments, and it's absolutely brilliant. It makes everyone feel lighter, and instead of tension, there's connection. So if your mom says it's 1972, instead of correcting her, you might just smile and say, "Well, if it's 1972, I better go dig out my bell bottoms." That little bit of playfulness softens a hard moment and lets the joy sneak back in. Hi, I'm Dr. Cynthia Libert. Today, I want to take a few minutes to speak to those of you who are walking this road of Alzheimer's disease with a parent or someone you love. If that's you, I want you to hear right from the start that you are not alone. Caregiving can be one of the hardest things you'll ever do, and at the same time, one of the most sacred. Day in and day out, you're showing up with love in ways that are practical and exhausting. And I know it can feel so heavy. And that's why I wanted to take some time to share a few words of encouragement with you and some tools that I've seen make a big difference for caregivers. My hope is that these give you a fresh perspective and maybe a little more strength for both you and your loved one. Tip number one is using humor as a communication tool. One of the biggest things that can shift the whole feel of caregiving is how we handle conversations. With dementia, the rules change, and there are some times when your loved one may repeat themselves, forget things in the moment, or say something that just doesn't seem logical. And if you try to argue or set the record straight, you'll almost always end up frustrated. But here's what I've seen. Some caregivers have learned to lean on humor in these moments, and it's absolutely brilliant. It makes everyone feel lighter, and instead of tension, there's connection. So if your mom says it's 1972, instead of correcting her, you might just smile and say, "Well, if it's 1972, I better go dig out my bell bottoms." That little bit of playfulness softens a hard moment and lets the joy sneak back in. Tip number two is learning about the disease. It makes a huge difference to simply understand what's going on. When you know what's happening in the brain, why the memory is failing, or the behavior changing, you can meet your loved one with more compassion and less fear. Here's what I mean. Alzheimer's is a disease that starts by damaging very specific areas of the brain. One of the first regions affected is the hippocampus, which is the brain's memory center. That's why your loved one may struggle to remember what you just told them, but can still recall vivid details of stories from childhood. The filing cabinet for new memories is broken, while older files remain, at least for a time. As the disease spreads, it begins to affect the frontal lobes, the part of the brain that helps with judgment and impulse control and social awareness. This is why you may notice personality changes, inappropriate comments, or difficulty with decision making. It's not that they suddenly don't care or are choosing to be difficult. It's that the circuits that normally help them filter or hold back aren't firing properly anymore. Later, the temporal and parietal lobes, which help with language, spatial orientation, and processing speed or processing information, can become affected. That's why someone might get lost in familiar places, misinterpret what they see or hear, or struggle to find the right words. On a microscopic level, Alzheimer's is driven by two major culprits: amyloid plaques and tau tangles. Amyloid plaques are sticky protein clumps that build up between the nerve cells, while tau tangles choke the cells from inside. Together, they block communication between the neurons and eventually cause those neurons to die. Imagine a city where highways are shut down and the phone lines are cut. You'd see traffic jams and confusion and breakdowns. That's what's happening inside the brain. It's also important to understand that the stress response in the body often ramps up as the brain declines. Cortisol, the stress hormone, can rise. Sleep cycles can become disrupted because the brain's circadian rhythms aren't functioning properly. And when sleep is poor, memory and behavior often worsen. Now, here's the thing that many families tell me they notice that it feels like Alzheimer's disease amplifies your loved one's old personality traits. If someone was a little stubborn before, they may seem really stubborn now. If someone was prone to worry, now anxiety is front and center. And it's easy to feel like they're just being themselves but worse. But what's really happening is that the disease is stripping away the brain's ability to regulate and balance. The filters are gone, so what you are seeing are raw behaviors, not intentional choices. I know education doesn't take the pain away, but it gives you clarity. And clarity is a kind of inner strength. It can steady us. When you understand that it's not your mom or your dad or your spouse trying to hurt you, but that their brain is struggling, you can approach them with more compassion and patience and grace. Tip number 3 is to have the tough talks. The next step is to think ahead, and this is where it gets tough. There are conversations that nobody really wants to have about driving, finances, and even firearms. But I promise you, having these talks early is such a gift. It may feel awkward or uncomfortable in the moment, but conversations like these protect your loved ones, their safety, they preserve dignity, and you can help prevent bigger crises down the road. So in many ways, it's the most loving thing that you can do. Driving is one of the hardest areas to address because it feels tied to independence and freedom. It's not just about the transportation, it's about their identity. And that's why this conversation is so sensitive. You might say something like, "Dad, I know how much driving means to you. Can we talk about how to keep you safe on the road as things change?" Or, "Mom, traffic is getting so much busier these days. Let's think together about what will make you feel most comfortable and safe." And remember, you don't have to be the bad guy here. Involving a doctor to reinforce this message can take some of the pressure off of you. Money is another area where things can go wrong really quickly with dementia. Missed bills, falling prey to scams, if you notice unusual withdrawals or a pile of unopened mail, bounce checks. It's important to have these conversations before this, but if you're noticing that, you may say something like, "Mom, you've carried the responsibility for the family's finances for so long, and you've done such a good job. Would it be okay if I started helping out just a little bit to make life easier for you?" Or how about we set up automatic payments for some of these bills? That way, it's one less thing you have to think about. And here's something important: getting a power of attorney in place before a crisis. It's a lifesaver. It means you can step in and help without messy legal battles. And then there's firearms. And for families where guns have been a part of life, this conversation touches deep into values and identity. But of course, firearms can become very dangerous in dementia. So you may say, "Dad, I know your guns are important to you, and I want to talk about how we can keep everyone safe while honoring that." Or, "You've always been careful and responsible with your firearms. Let's make a plan now so that that same level of safety continues." Sometimes it means locking them away, sometimes removing them altogether. Community programs can help if you need options for safe storage, so you may want to check on that in your area. The key is respect, just framing it in a way that you're helping to protect their legacy of safety and protect the loved ones. So, yes, these are not easy conversations. Driving, finances, firearms, each of these touch on independence and dignity and identity. But having these conversations early on, you can avoid emergencies later on, improve the situation for everyone involved. And and the beautiful thing is that when you have these conversations with love, they can actually bond and increase dignity for your loved one. Tip number 4 is getting the paperwork in place. And while we're talking about preparation, let's talk about legal and financial matters in more depth. It is definitely an act of kindness for everyone involved. Things like power of attorney, wills, care plans. Once they're in place, you can breathe a little easier and focus on your relationship and not just the responsibilities. And instead of worrying about the what ifs, you get to simply be and spend time and be more present. So, tip number 5 is please come to your medical appointments with your loved one. It's really practical and it helps so much to go to the appointment, to doctor's appointments with your loved ones. Sit in the room, take notes, listen, ask the questions that need to be asked. Then you're not left trying to piece things together afterwards, and your loved one feels supported. It just makes the whole process less overwhelming for them and for you. Tip number 6 is to look deeper for treatable causes. So, when you're in those appointments, many families don't realize that not all memory loss is Alzheimer's disease. B12 deficiency, thyroid imbalance, sleep apnea, even certain medications can mimic dementia. Studies suggest up to 10% or more cases of dementia may be reversible when the root cause is treated. Sometimes what looks like a dead end is actually just a detour. So that's why it's so valuable to work with someone who will dig deeper and ask better questions and look for treatable causes. Tip number 7 is proactive grieving. Even with the best medical care, this journey of Alzheimer's involves loss. It's often described as a series of little goodbyes. While your loved one may be here physically, you lose pieces of them over time, shared memories, ability to recognize a face, their role in the family. And it's grief. It's plain and simple, and it's important to name it. We sometimes call this anticipatory grief, the grief that you feel before the final goodbye. And it shows up in the small moments when dad can't recall your name or mom doesn't remember your wedding, when family gatherings or traditions look very different. The grief is normal, and it doesn't mean you're weak or that you're failing as a caregiver. You're just human and you love deeply. And the temptation is to push it down and to power through because there's always so much to do. But if you don't allow space for your grief now, it can build up and overflow in ways that might catch you off guard in the future. So I encourage you to proactively grieve, and there's ways to do that. You can journal, just write out what you miss, what feels heavy, what you wish were different. Putting the words on the paper can give you kind of a safe container for your grief. You can also pray. I encourage you to take your grief to God. The Psalms are full of lament. David didn't keep it from God, and neither should you. It's important to just be honest with God and share it with a friend, a loved one, a support group, a counselor. Sometimes just speaking your grief out loud can help release some of the weight that comes along with it. And you can also just mark it down on the calendar when milestones are reached, when something important is forgotten or a task can no longer be done. That just lets you honor it. You can, light a candle, say a prayer, just acknowledge and release it. And always critical to balance that process out with gratitude, looking for those little moments of shared connection, a touch, a smile. Those are gifts. And so proactive grieving doesn't mean that you're giving up. It means that you're giving your own heart permission to feel what it needs to feel in real time instead of just waiting for it to explode later on. So it's a way that you can love yourself through this journey. So I want to encourage you maybe to ask yourself, what grief are you holding on to right now? And what would it look like to give yourself permission to name it and to pray about it? Tip number 8 is to care for yourself. Grief, exhaustion, all the caregiving, we tend to, be left with nothing in our own cup, and you can't pour from an empty cup. So even Jesus, he stepped away from the crowds to rest and pray. And self-care doesn't have to be a weekend at the spa, although that would be nice. It could be a walk in the fresh air or listening to music or calling a friend. These are little pockets of restoration for your soul. Tip number 9 is to seek ways for reconnection. So self-care isn't just about you. It is about others, allowing you to show up in ways that you can reconnect. Um, Alzheimer's doesn't erase the soul of your loved one. Deep inside, your loved one is still there. And one of the best ways that you can draw out that spark is to lean into what brings them joy or a sense of identity. Things like music can be a powerful tool. So long after words are gone, music often remains. And so singing a favorite hymn together or a song from their teenage years, that can help them get back in touch with those deeper emotions. And it's amazing. I've seen people not be able to speak for a while, and then able to break out into sing Amazing Grace. So faith practices can also open a door. So reading scripture together, reading aloud, or just sitting quietly, saying a prayer. Even if your loved one can't respond with the words, just the rhythms and the cadences of the faith practices can often feel very safe and familiar and peaceful. Maybe simple, flipping through a photo album can engage part of their brain. They can still hold on to beauty and stories of the past. Even if names are gone, just those emotions tied to the images can still remain. And so don't forget about the senses. The sense of smell is very powerful. So a warm meal, the feel of a warm blanket, feeling the sun on the skin outside. These are ways that you can help your loved one connect. And you have to care for yourself to be able to be in a place to connect with them on this level. So being intentional about weaving in those moments into the week is a beautiful thing. Just 5 minutes of singing or flipping through a photo album, taking simple walks outside really do matter. And tip number 10 is to build a team. It's not a solo sport. Being a caregiver is very demanding, and we can't do it alone. That's why building a team around you really is not optional, it's essential. So caregiving, it takes a community, and when you allow others to come alongside you, you're not only lightening your load, you're giving them the gift of being a part of something really meaningful. So what does a team look like? It can be as simple as family members who rotate responsibilities. Maybe one handles meals, another manages bills, another takes a loved one to appointments. Church family, people who can drop off meals, sit with your loved ones, or just allow you to take a break or just sit and pray with you. Neighbors who might be willing to show up, maybe mow the lawn, pick up groceries, or check in from time to time. Of course, the healthcare team, healthcare professionals, doctors, nurses, social workers will bring expertise and perspective, and it's important to have a good team on your side. So, support groups, there can be online or in person. These can often be lifelines. Just talking to someone that gets it can make a big difference. Too many caregivers really carry this guilt for needing support, but it's so important to do it well. And when you're not drained, when you're personally, having more resilience and reserve, you can show up with more patience and more energy and more love in the matter, in the times that matter the most with your loved one. So I encourage you to think about who might be in your circle. And I know sometimes it can be hard to ask for help, but it's worth it. So I encourage you on that. Thanks for watching. If you enjoyed this episode of Rethink Aging, please like, subscribe, and share it with someone you love. For more episodes and highlights from the show, you can check out more videos right here and here. I also invite you to join the Rethink Aging community at caringforthebody.org, where you can find more resources on how to better protect your brain, strengthen your body, and live with purpose. Thanks again for tuning in, and I'll catch you in the next episode.